Hello, this is Dr. Evan Osar, co-founder of Massage Therapy Insider and author of the Corrective Exercise Solutions to Common Hip and Shoulder Dysfunction. Thank you so much for tuning into Part 3 of Posture and Movement, improving the massage therapy experience for even greater client results, retention, and revenue. In Part 2 of Posture and Movement, we define posture. We define posture as a snapshot of an individual's stabilization and movement strategy. When our clients have a good postural and movement strategy, they can work towards achieving their health and fitness goals with less pain, tightness, and dysfunction. We also discuss why it is important to feel rather than just observe posture, because our eyes often lie to us and at times tell our hands what to feel for. Our hands tend to be much more accurate assessment tools than our eyes. We also discuss an example of what do you feel for, in this example, our client's trunk and spine, to determine if they're in their correct position. In our trunk and spine, for example, we want to feel that the trunk is aligned and symmetrical and that it's positioned over top the pelvis, and there should be a slight thoracic kyphosis and lumbar lordosis when the spine is palpated in a neutral position. Be sure to palpate for these curvatures in your client, because the lack or reversal of these curvatures is what drives a lot of your clients' common postural and movement syndromes. We'll address exactly how to assess and improve these curvatures as part of our postural and movement instructor training coming next month. So let's get on to Part 3 of Posture and Movement. We have discussed and will discuss our client's strategy. In particular, what strategy are they using to maintain their posture and to move from? So what exactly is a strategy? A strategy is defined by Wikipedia as a high-level plan to achieve one or more goals under conditions of uncertainty. So our client strategy then is that high-level plan that the nervous system will utilize to develop their posture and movement. In other words, how does the nervous system utilize the myofascial system to organize posture and movement? So what determines what our nervous system develops as a postural and movement strategy? There are three primary categories of factors that determine what strategy our clients will employ: their history, their hobbies and occupation, and their habits. We'll look at each of these categories next. Our client's history will determine much of why they adopt certain posture and movement strategies. For example, pregnancy, surgery, and chronic pain each has an effect on what strategy our clients will adopt. Pregnancy, the weight gain, ligament laxity, and overstretching of the abdominal wall, and or C-section each has a significant effect on a woman's body long after she's delivered her child. Surgery has perhaps the greatest effect on our client's posture and movement for several reasons. All surgery, no matter how minor the surgery is, causes muscle inhibition. Muscle inhibition creates compensation and causes other muscles to become overactive. It is these overactive muscles that creates most of the chronic muscle tightness and trigger points that we treat as manual therapists. Additionally, all surgery creates scar tissue that often doesn't show up or manifest for years after the surgery. So your client's C-section, gallbladder, or low back surgery 10, 15, 20 years ago can be the very reason they are experiencing posture and movement issues today. You must inquire about past surgeries, traumas, broken bones, etc., because the reason they are experiencing dysfunction today can often be directly linked to the compensatory patterns adopted from these issues. Chronic pain and emotions. How your client internalizes their stress affects your client's posture and movement. Think about when you were feeling down or experiencing chronic pain. Do you feel like holding good posture, or do you move with confidence? Of course not. Our clients with chronic pain, depression, or chronic stress will generally have non-optimal posture and movement patterns that cause them to search out experts like you. How your clients live in their life. Their hobbies, including exercise and recreational activities, as well as their occupation, whether they sit at a desk or do manual labor, will determine their posture and movement as well. As we will discuss in further detail during the Posture and Movement Instructor course, just because someone exercises, for example, doesn't mean they're doing it in an optimal fashion or doing things that are good for their body. Think about when you see someone walking, running, or riding a bicycle, and you see their shoulder blades slumped, their client's valgus position, or excessive motion that they shouldn't be doing. And if you belong to a health club, you know exactly what I'm talking about when I say that there are a whole bunch of potential clients exercising in a club near you. These patterns that are developed during work, during recreational activities, during exercise, even exercise that is deemed good for us like Pilates and yoga, can be the very cause of our clients' posture and movement dysfunction. The third cause of our clients' postural and movement dysfunction is their habits, how they live in their body, and how they lift, how they bend, how they sit at their desk are all major contributors to their poor posture and movement patterns, especially our clients that sit. For the majority of us, the bulk of our clients sit for a living, and they sit on their way to their job, they sit on their way home from their job, and oftentimes they sit for exercise. The sitting posture is extremely detrimental to our clients' posture and movement strategies because it shortens certain muscles and lengthens others, and generally inhibits muscle integrity once they get into an upright posture. These habits, developed because of a culmination of all that happens to us in our life, our daily routine, our daily work routine, our exercise routine, tends to be routine and repetition that we develop, that causes us to develop less than optimal muscle recruitment patterning, which leads into chronic posture and movement patterns. So what do our clients' history, their hobbies, and their habits tell us? The information collectively illustrates why they have adopted their specific postural and movement strategies and why they've developed their specific muscle imbalances, tightness, and pain syndromes. What we have to do as manual therapists is know how to accurately assess our client so we know where best to direct our treatment plan and protocol. The information gained from our client's history, hobbies, and occupation and habits will direct our assessment, which ultimately determines what we do from a manual therapy standpoint. As well, it directs what strategies of self-care we want to send them home with. It is in the self-care, the postural education, the stretches, the corrective movement patterning, where your clients develops the independence and ability to be the director of their own health, and where you move from being successful as a manual therapist to being significant, where you not only empower your client, you make a lasting difference in their life. Conclusion. In this webinar, we discuss how our clients' history, trauma, surgery, etc., hobbies and occupation, what they do and like to do, and their habits, essentially how they are living inside their body, determine their postural and movement strategy. We must be able to accurately assess their posture and movement so that we can institute both an appropriate manual therapy strategy as well as an appropriate self-care and home strategy. In part 4, the final part of the Posture and Movement webinar series, I will share with you a case study so you can see how to exactly put this information together to improve your results with your clients so you can experience even greater results, you get even greater client retention, and you generate even more referrals and revenue. Because you're in a powerful position to be the expert, that resource your clients need, want, and will pay for. I want to thank you for listening to this webinar and hope that it has helped you remain informed so that you can be the go-to expert for your clients and your potential clients. If you found this information useful, feel free to pass it on to your colleagues. This is Dr. Evan Osar with Massage Therapy Insider. I'll see you in part 4. Take care.